You're eating well, taking your medications, doing everything your doctor recommended, yet your blood sugar stays high, and no one seems to know why. The truth is, high blood sugar isn't always caused by diabetes itself. It can be a warning sign that something else in your body isn't working as it should. In many seniors, hidden medical issues quietly interfere with insulin and glucose control, sometimes long before a diagnosis of prediabetes or type 2 diabetes is ever made. According to the Mayo Clinic, nearly 1 in 3 adults over 60 have elevated blood sugar linked to underlying conditions, not just diet or weight. In this video, you'll discover 5 medical conditions that can silently raise your blood sugar, how they work, and what you can do to take back control. Stay with us to the end because the condition I cover last might be the one behind your stubborn symptoms. At Golden Aging Health, I'm here to help you take control of your health after 60. Subscribe for trusted, senior-focused guidance every day. Now, let's take a look at the first condition, one that affects millions, but often goes completely undetected. Condition number 1. Sleep apnea, the silent disruptor. It might surprise you, but one of the most common causes of high blood sugar in seniors happens while you're fast asleep. It's called sleep apnea, and it affects millions of older adults, often without any diagnosis. Sleep apnea is a condition where your breathing stops and starts repeatedly during the night. You may not notice it, but your body does. Every time your oxygen drops, your brain sounds the alarm, releasing stress hormones like cortisol, which tell your liver to pump out extra sugar for emergency energy. Mr. Jenkins, 72, thought his morning fatigue was just normal aging. He ate healthy and took his meds, but his fasting blood sugar kept creeping up. It wasn't until his wife mentioned his loud snoring and gasping at night that his doctor ordered a sleep study, and sure enough, he had moderate obstructive sleep apnea. After starting CPAP therapy, his energy improved, and his fasting glucose dropped by nearly 20 points in just 3 months. And here's the shocking part. Up to 80% of people with sleep apnea don't know they have it, according to the American Sleep Apnea Association. But getting tested even at home could change your blood sugar story entirely. So, what signs should you look for? Loud or chronic snoring. Waking up with a dry mouth or headache. Feeling groggy or foggy even after a full night's sleep. Mood changes or needing naps during the day. If any of that sounds familiar, talk to your doctor about a sleep study. Treatments like CPAP therapy or even weight-neutral lifestyle changes can improve both sleep quality and blood sugar control. Has someone in your family ever struggled with sleep apnea without even knowing it? Share your experience in the comments. It might be the missing clue someone else is searching for. Up next, a small gland in your neck might be doing more than you think, quietly throwing off your metabolism and pushing your blood sugar higher, day by day. Condition number 2. Thyroid. Imbalance, how it affects your blood sugar. Oprah Winfrey, one of the most well-known figures in media, has openly discussed her battle with hypothyroidism. Despite her best efforts to eat healthily and stay active, she struggled with fluctuating energy levels and high blood sugar. After getting her thyroid levels tested, she learned her thyroid was underactive, which was contributing to her health struggles. An underactive thyroid, or hypothyroidism, slows down your metabolism, making it difficult for your body to process blood sugar efficiently. When your thyroid isn't working properly, blood sugar can rise because your insulin becomes less effective. On the flip side, hyperthyroidism, an overactive thyroid, can cause excess glucose to be released into your bloodstream, leading to unpredictable spikes in blood sugar. To visualize it, think of your thyroid like a traffic light. If the light stays on red, slow thyroid, everything else like insulin gets backed up, causing your blood sugar to go up. But when the light is green, proper thyroid function. The flow of glucose is smooth and controlled. In many cases, thyroid medication or treatment can help normalize blood sugar levels. Medications like levothyroxine for hypothyroidism can help restore normal thyroid function, and this can help your insulin system work properly again. Symptoms to watch for: feeling tired or sluggish, dry skin, hair loss, or brittle nails, unexplained weight gain, sensitivity to cold or brain fog. Here's what you can do. Request a thyroid panel from your doctor. This test will check for TSH, thyroid stimulating hormone, and free T4 levels. If diagnosed with hypothyroidism, your doctor might recommend thyroid hormone replacement therapy. Maintain regular checkups to monitor your thyroid levels and adjust the treatment as necessary. Getting your thyroid tested could be the missing link in managing blood sugar. Once diagnosed, proper treatment can improve blood sugar control and help you feel more energized. Another important factor that could be impacting your blood sugar, and I'll talk about it right now. Condition number 3. Hidden infections that disrupt blood sugar. Mr. Thompson, 71, had always managed his blood sugar well, or so he thought. But lately, no matter what he did, his fasting blood sugar was climbing steadily. He ate well, exercised regularly, and took his medication. Then, his doctor discovered something he hadn't expected: a chronic, low-level urinary tract infection, UTI, that had gone unnoticed. The infection was so mild that Mr. Thompson hadn't experienced the typical burning or pain when urinating, but his body was still fighting it. When your body is fighting an infection, even a seemingly minor one, it releases stress hormones like cortisol. Cortisol can make insulin less effective, leading to higher blood sugar levels. In Mr. Thompson's case, the untreated infection had been silently raising his blood sugar for months. Once treated with antibiotics, Mr. Thompson's blood sugar levels started to return to normal within a few weeks. This is why it's crucial to pay attention to chronic infections, even if they seem mild. An untreated UTI, gum disease, or even a fungal infection can all cause your blood sugar to rise, making it harder to manage diabetes. Key signs to look out for: unexplained fatigue or feeling run down, frequent urination or discomfort when urinating, swollen, bleeding gums, or oral pain, unusual pain or discomfort in any part of the body. If your blood sugar won't cooperate, get checked for hidden infections. It might be the silent enemy you've overlooked. Golden Aging Health brings you daily tips for healthier living. Like and subscribe to stay connected with practical advice and take charge of your health every day. Curious about the next condition that could be quietly raising your blood sugar? Stick around, you won't want to miss this. Condition number 4. Kidney disease disrupts insulin and blood sugar control. Chronic kidney disease, CKD, can silently disrupt your blood sugar control. Many seniors with diabetes may not even realize the significant impact it has on their health. Studies from the National Kidney Foundation indicate that kidney function plays a vital role in clearing excess insulin from the body. When the kidneys are impaired, insulin clearance is reduced, leading to higher blood sugar levels. This means that even if you're controlling your food and exercise, your kidneys may not be efficiently processing insulin, causing glucose to build up in the bloodstream. The story of Mr. Walker, a 72-year-old, as an example. He had been struggling with elevated blood sugar despite his best efforts. After a routine checkup, it was discovered that his kidney function was impaired. His doctor explained that his kidneys aren't filtering out excess insulin, contributing to his elevated blood sugar levels. In this case, the kidneys are like a filter. If the filter is clogged, the system can't work as it should. Insulin and glucose build up, leading to higher blood sugar levels. How can you manage this? Keeping track of both kidney health and blood sugar is essential. Regular tests to monitor kidney function are crucial. Additionally, controlling blood pressure, staying hydrated, and adjusting diabetes treatment based on kidney function can significantly help stabilize blood sugar levels. For Mr. Walker, his doctor updated his treatment plan to address his kidney function, and within a few months, his blood sugar was much more controlled. Watch out for these early warning signs of kidney disease. Swelling in the legs, feet, or ankles. Frequent urination, especially at night. Unexplained fatigue or weakness. Shortness of breath or difficulty breathing. If you have diabetes and notice any of these symptoms, it's important to talk to your doctor about kidney function. Early detection and proper management can help prevent further complications. Feel free to share your experience in the comments. It might help someone else spot these signs early and take action. The last factor we'll explore is one that often flies under the radar but could be the missing piece in your blood sugar puzzle. Let's uncover it. Condition number 5. Stress, the hidden blood sugar trigger. Think about the last time you felt truly stressed. Did your body feel shaky, uneasy, even if you didn't eat anything sweet? Stress isn't just something that affects your mood, it can directly impact your blood sugar. Studies from Mayo Clinic reveal that chronic stress increases the production of cortisol, a stress hormone. When cortisol levels rise, your body responds by releasing more glucose into the bloodstream, making it harder to control blood sugar levels. James, 70, a retired engineer, noticed his blood sugar spiking whenever life's pressures built up. It wasn't until his doctor inquired about his emotional well-being that the link became clear. James had been coping with family challenges, and the ongoing tension was causing his cortisol levels to rise, which in turn led to higher blood sugar. Imagine your stress hormones as a constant emergency signal, prompting your body to release extra glucose for quick energy. But unlike a true emergency, this extra glucose does more harm than good, making it even harder to manage blood sugar levels. What can you do to manage stress and keep your blood sugar in check? Engage in mindfulness practices like yoga or deep breathing to reduce cortisol levels. Get regular exercise. Even light activity like walking can help lower stress and blood sugar. Prioritize sleep. Lack of sleep can increase stress hormones and worsen blood sugar control. By managing stress, you're not just protecting your mental health, but you're also taking control of your blood sugar. Does stress seem to push your blood sugar higher? Share your experience in the comments. In conclusion, managing blood sugar goes beyond just diet and exercise. Hidden factors like stress, thyroid imbalances, and kidney health can quietly disrupt your efforts, making it harder to maintain control. But the good news is, you can take action. The impact of underlying health conditions on blood sugar is often overlooked, but addressing them can be key to better control. By monitoring and understanding your body, you can take more informed steps toward managing your diabetes effectively. Keep track of these hidden triggers and stay proactive in seeking the right care. It's all about connecting the dots and finding the right balance for your health. If you found this video helpful, please give it a thumbs up and subscribe for more tips on senior health. Share your experiences or any questions you have in the comments. We'd love to hear from you. Thank you for watching Golden Aging Health. I'm here to guide you every step of the way toward healthier aging and better blood sugar control.